ChatGPT, OpenAI, artificial intelligence. Can they help you make a decision when it comes to Medicare? Do they know anything about Medicare? Well, in fact, it can a little bit. And I actually asked ChatGPT the very question, what are 10 things that Medicare beneficiaries need to know? And so today I'm going to reveal ChatGPT's answers to you and also let you know where it missed and did it answer correctly or not. Hi, I'm Chris Prang, the Medicare analyst, licensed agent based out of Charlottesville, Virginia, also licensed in other states, which you will see at the end of this video. So first, what is ChatGPT if you're not familiar with it? Well, I asked ChatGPT exactly what it is, and here's what it said. ChatGPT is a large language model developed by OpenAI based on the GPT, Generative Pre-trained Transformer Architecture. It is designed to process and generate natural language text, allowing it to converse with humans in a way that stimulates human-like language abilities. ChatGPT has been trained on a vast amount of text data and can perform a variety of language tasks such as text generation, language translation, question answering, and more. ChatGPT is one of the most advanced language models available today and is used in a wide range of applications, including chatbots, language assistants, and natural language processing tasks. So what can ChatGPT do? ChatGPT can generate human-like text in a variety of styles, formats, including articles, stories, poetry, and more. It can solve complex scientific and mathematical problems. It can translate text from one language to another, and it can answer questions in a wide range of topics by drawing on its vast knowledge base, like what are 10 things Medicare beneficiaries should know? I also asked a question about what kind of problems it can solve, and it said, however, ChatGPT is not a general problem solver like a human being. It does not have common sense reasoning or the ability to perform physical tasks in the real world. So it can't tell you specifically what Medicare plans and options make the most sense for you personally. Only an experienced agent like myself and yourself can help solve that problem. So let's go in to the 10 things that ChatGPT says you should know about as a Medicare beneficiary. Number 1, enrollment. ChatGPT says Medicare enrollment generally occurs during a 7-month period around your 65th birthday. However, you can also enroll during an annual open enrollment period from October 15th to December 7th each year. So this is sort of correct, but also a little misleading. So the 7-month window is when you're first becoming eligible for Medicare. And you have 3 months before the month of your birthday, the month of your birthday, and the month after your birthday to make any additions to your original Medicare coverage, drug plan, Medicare Advantage, or a supplement. The annual election period, however, is reserved exclusively if you have Part C or Part D, or you want Part C or Part D at that time. That's when you add or make a change. It is not when you officially enroll into Medicare at that time. Number 2, coverage. Medicare has several parts that cover different services, including hospital stays, doctor visits, prescription drugs, and more. It's important to understand what each part covers and what you may need additional coverage for. So I believe it got this correct, and it is important to know the coverage you have and don't have, and to figure out what you want and you don't want so you can make a wise decision about which Medicare plan you choose. Number 3, costs. While some Medicare benefits are quote-unquote free, such as Part A hospital insurance, other parts require monthly premiums, deductibles, copayments, or coinsurance. Knowing what you'll pay out of pocket is crucial for budgeting. Yes, it is. That's why I reveal all of your Medicare options with you. Drug plans, Medicare Advantage, supplements, to find out what is going to suit you the best for you individually. Not for somebody else, but for you individually. So costs are important. You need to understand how they work. Number 4, networks. Not all healthcare providers accept Medicare, and some may only accept certain parts of it. Make sure to check with your healthcare provider before receiving any services to avoid unexpected bills. This is very true, and unfortunately what happens is a lot of people are extremely unwise and gullible, and they call those 800 numbers they see on TV or a flyer they got in the mail, or they even answer the phone from an 800 number, and the next thing they know, they're enrolled in something they have no clue about, so you need to be careful. But networks are very, very important. When it comes to original Medicare, there is no network. Most providers, probably about 95%, accept Medicare assignment. You can always ask your provider, do you accept Medicare assignment? That means they've agreed to the terms and conditions of Medicare's payment. Now, when it comes to networks, that means Medicare Advantage. And some of them are strict and some of them are small. So it depends which one you are choosing. So you need to be careful. When it comes to an HMO, typically you are restricted to that network unless it's an emergency or urgent care situation. If it's a PPO, well, then you can go out of network, but it may be more money. But there are going to be more restrictions when it comes to networks. Now, some of the insurance companies have very, very large networks, and most providers are in their networks, but not all of them. And that's why it's important when you're reviewing your options, we make sure that your doctors are in network. And if they're not, at least you know ahead of time. Number 5, speaking of Medicare Advantage plans. These are private insurance plans that replace original Medicare and offer additional benefits such as dental, vision, and hearing coverage. However, they also have different rules and restrictions. Well, one of those I just mentioned, and that's the network. Other rules and restrictions are going to be prior authorizations. Under original Medicare, very rarely do you need a prior authorization for a medical procedure, but under Medicare Advantage, there's a reasonable possibility after a while you're going to need a prior authorization either for a medication or for a certain procedure. As long as you understand how that works, then it's not going to be so bad. But if you're not used to it, well, it could be a bit of an issue. So those are things that we can talk about when you're making a choice. Number 6, prescription drug plans or medication coverage. Medicare Part D covers prescription drugs, but plans have different formularies, copayments, and premiums. It's important to compare plans to find one that covers your medications at the lowest cost. Very important and very true as well. Way to go, ChatGPT. So depending on the state you're in, there could be anywhere from at least a dozen to maybe 3 dozen different drug plans to pick from. And usually it comes down to just a few of them that have the lowest overall cost. The challenge is these plans change every year. The formularies change, the pharmacy networks change, the co-payments change, and so you need to be careful. Just because you're on a good drug plan now doesn't mean next year you will be. So if you have, especially a standalone Part D, you need to check every year. And the best resource to do that is Medicare.gov. That's what I use. I use their prescription calculator. Is it 100% accurate? I personally don't think so, but it is the best resource that you have. It gets a little tricky during around the annual election period when it's making changes from September to October. Okay, so you do need to be careful, but it is your best resource. So when I talk with somebody, we review options. We always look at the medication coverage, and it's one of the first things that we do. Number 7, preventative care. Medicare covers many preventative services such as screenings for cancer, diabetes, and heart disease. These services are designed to help catch health problems early when they are easier to treat. Amen. Preventative care is very important. And in most Medicare plans, on original Medicare, most Medicare Advantage plans, the preventative services, there's a whole list of them in your Medicare and U-Book. These are all covered at no cost, whether it's a cancer screening, whether it's a flu shot, your annual wellness visit, help with smoking cessation, whatever it is. These are generally are all at no cost and should be taken advantage of. And the best person to talk to is your primary care provider about that. Appeals, number 8. If Medicare denies coverage for a service, you have the right to appeal the decision. You can also file a complaint if you're unhappy with the quality of care you received. A lot of people do have complaints, unfortunately, when it comes to Medicare or their coverage or a provider, and sometimes they just let it go. But if you have a serious issue or a bill that you don't think you should be paying or as much you should be paying, then you should file a appeal either directly to Medicare or to the insurance company if you're on a Medicare Advantage plan, and sometimes to the provider. Like if you got a bill and you don't think you owe it, you can touch base with the provider. Many times they don't code properly. Many times the bill needs to be resubmitted. They haven't got payment yet when they've sent you a bill, and in between maybe they've received it. So before you pay a bill, always make sure. Number 9, extra help. If you have low income, you may qualify for extra help with Medicare costs such as premiums, deductibles, and copayments. This assistance can help you afford necessary health care services. Okay, this is important and it's partially true. So extra help does exist. It is a benefit from Social Security and is exclusive for your Part D, your drug. So if your income is below a certain limit, your resources are below a certain limit, then you qualify for extra help. And what that does is it reduces your premium down to potentially zero on your drug plan, reduces your copayments and your deductibles, more than likely is going to keep you from hitting the donut hole or dealing with the higher co-payments during the donut hole. So it can be very helpful to people. But if you are over by 1 penny of your income or your resources, then you don't get any benefit whatsoever. Number 10, scams. And boy, are there a lot of them. Medicare fraud and scams are unfortunately common. Always protect your personal information and never give out your Medicare number to someone who calls or emails you unexpectedly. To this day, I don't understand why people pick up the phone when an 800 number calls them or why they call an 800 number ad on TV, because odds are you're going to get hoodwinked. You're going to get into something that is not suitable for you, or you're going to have no clue why. And I could go on and explain many circumstances that some of my clients have dealt with. I have had numerous clients call the 800 number, the 800 number calls them, and the next thing they know, they're enrolled. And when they hang up the phone with the 800 number, the next thing they do is they pick up the phone, they call me, and they say, Chris, I think I made a mistake. And I said, what did you do? I know what they did, but what did you do? And they tell me. So I either have to solve their problem or I have to tell them how to solve their problem. Your best bet when it comes to enrolling in Medicare is not an 800 number. Okay, you use an experienced agent like myself. You can find others, I'm sure, on YouTube as well. A good local agent can be helpful if you can find one in your area. Those are your best resources to deal with. So, did ChatGPT answer correctly? Yes, but I would say with limited information. I would also add a couple of things that ChatGPT didn't mention that I think it's important for Medicare beneficiaries to know. And that is, which I've already brought up, are the prior authorizations when it comes to Medicare Advantage. That would be important to know. You don't need any surprise. Also, that Medicare covers skilled nursing, but it doesn't cover long-term care. Some people still think that if they're on Medicare and they need to stay in skilled nursing for more than 100 days or for a year or something like that, that Medicare is miraculously going to cover them. Well, it doesn't. Okay. If you qualify for Medicaid, then Medicaid might cover you for long-term care, but Medicare does not cover you. And so you can go to my other videos, 7 Medicare facts you need to know about that. So do you have questions? Do you need help? My goal is pretty simple. It's to help you make a wise and confident decision about all of your Medicare choices. You can go to my website, themedicareanalyst.com. There is a lot of information on there. There are a couple contact pages on there if you want to reach out to me with questions, you need a review on the current Medicare coverage you have, then fill out the contact information and I will get back to you and we can schedule an appointment. If you happen to live within an hour or so of the Charlottesville, Virginia area and you would like to meet in person, okay, contact me, let me know, and we can probably work that out. States I'm currently licensed in, obviously Virginia, also North Carolina, South Carolina, Florida, and Tennessee, with more states coming soon. So here's where you can help me out. Wherever you're watching from, put the state in the comment section below, and as I see where people are watching from, then I will start getting licensed in those states. If you like what you see, then click the like button for me. Share it with somebody that may need some help with Medicare, and by all means, please subscribe for ongoing Medicare content that you could find very beneficial. So that's it for today. That's what ChatGPT says are the 10 things that you need to know as a Medicare beneficiary. Thanks a lot, and make it a great day.